Monica Lakhanpal Gaggar. She is a co-managing partner of Gaggar and Partners, solicitors and advocates. She has been instrumental in sensitizing and conditioning the women working in forces such as IPS and CISF regarding sexual harassment at workplace. She is dedicated to the cause of women and children. She advises several listed companies, board committees, financial institutions and directors, private equity players on an array of such issues. We welcome you, ma'am. Good afternoon.
Thank you so much.
Yes, ma'am. So Ms. Monica is here to talk to us on gender issues.
All right.
Yes, ma'am.
So I'd like to first start the discussion by saying, everyone is relating it to gender. I want to explain there may not be a direct gender correlation between the pandemic and women per se. However, I want to also clarify one thing. I mean, a lot of people are asking, even lawyers today, are women more vulnerable to it? Why are we discussing about this? But we have to bear in mind today that this pandemic has deepened the pre-existing inequalities, exposing our vulnerabilities in social, political, economic system, which in turn has amplified the impacts of this pandemic. So there is no direct correlation, but yet it has affected us every which way possible. In fact, United Nations has rightly termed the undue burden on women as COVID-19 shadow pandemic. And we need to really evolve now and understand how we can try and tackle this, because like my predecessor just said that, you never know whether there's going to be a third wave. We as lawyers are trying to understand and manage our work with very limited strength. Our courts are off. I mean, very few judges sit. We've lost so many judges, so many lawyers every day. Going through that anxiety every moment to then prepare for cases is not been easy. I mean, I have just recovered from COVID, and when I'm arguing today, there are times I get a blackout, and it's not being fair on my client or myself. I have to actually request the judge, and the judge is also going through the same thing. So we need to understand how we better utilize for women. How do we tackle our anxiety? How do we tackle our health? How our families and a society can come together helping women in this situation. Would you like to ask me a specific question, or can I just start explaining?
Ma'am, I'll ask you questions and you can explain on the grounds, ma'am.
Yes.
So from what you've said, I understand, and we all know the ground reality that women are usually overburdened in the society, also at home and in workplace. So how have these ridges been deepened, as you said, during the pandemic, ma'am? And is there a role of gender at all, if there is?
There's definitely a role of gender in everything when we talk about any kind of pandemic or epidemic. COVID-19 pandemic, for example, has forced the world to embrace a new normal. We have gone into self-isolation, physical distancing. We've kept our society away from us. There is no one to share our fears or anxiety. With this comes onerous responsibility on us as women, whether working, non-working, and I don't call them non-working because they're working harder than us. But the responsibility falls disproportionately on men, on women of our country. Being a mother, a wife, a daughter-in-law, a sister. Somehow we've defined women as homemakers and not men. I don't understand why. Wish it was a joint responsibility, especially during the time of crisis. We need to understand both of us. Virus is not discriminating between us. We all are getting infected irrespective of our gender. Then why this discrimination? And it goes on and on and on. It doesn't stop. While women were already doing most of the unpaid jobs at home, the onset of this COVID pandemic and emerging researchers have shown that the crisis and subsequent lockdown have actually resulted in dramatic increase of their burden, which I've also seen personally. During this pandemic, the patriarchal face of our society has become very evident and cruel. I've come across cases, I mean, every day, even, I'm not saying immediate neighbors, but we've come across so many cases around our neighborhood where the entire family has been infected and they are now recovering. But unfortunately, the recovering exception for women is very different. While other people have been asked to rest as advised by doctors, which is fair advice, but it doesn't work for women. Women have to take care of everything. They have to supersede all health protocols. They have to cook, they have to clean. There are no house helps coming nowadays. managing household, children, there are no schools, everything is online. So additional burden and court work for me and for other women, different kind of jobs for everyone. We do not realize that every one of us is going through the same crisis till actually we collapse. That's when they all awake and they say, oh my God, she's going through something. Weird as it may sound, but for the sake of convenience and comfort, our society has make us, always make us a weaker gender. But when it comes to pandemic and crisis, we are the superhumans. We are supposed to do everything. Then how are we weak? It just doesn't make sense. At times I actually ask some of my clients who are going through this, I said, on one hand, I used to hear, oh, they are very weak. Suddenly they become superhumans. They are supposed to do everything. Everything is expected out of them. People like us and maybe people on this panel may think differently because we've not gone through this. We've not gone through this situation. But we have to bear in mind that India is not about modern urban class, or majority of women are not as vocal, as independent like us, that today we are talking about it. We've got the time, we've got our family support. We are very minuscule in number, but we do have a voice. We do have resources. And we can bring a change. We need to really stand up for the gender that really needs our help today. One more very important issue that I dealt, during this pandemic was the impact due to the biological vulnerabilities of female gender, which triggered and was described as sanitary pad crisis in India. Now, one is the superficial view of it. One is to really understand, before addressing this, I was trying to read about it and I spoke to a few people, including the helps who come. There are 10 people living in a 1/4 flat in Delhi, in slums. They don't talk about menstruation openly. It's a taboo. It is not openly spoken about. When they get their periods and they need sanitary pads, they cannot ask anyone. There is a lockdown. There are no chemists available who's going to do home deliveries at home. There is one bathroom available between 10 people. And unfortunately, these women are taken as untouchable during menstruation. So as to say, they can't even go to the kitchen, but now they are cooking also. It's very convenient for everyone. They were telling me that, ma'am, we have to use cloth, which we can't even dry at times. We can't, because our husbands are not going out working. There used to be that bracket that we used to do all of this. But now we are really struggling. There are, of course, organizations now supplying them sanitary pads, doing everything possible. And I'm sure the government is also doing their bit. But people are really going through a lot. There are pregnant women who faced major backlashes amidst this pandemic. Most of them were not allowed to give childbirth in the hospital because of, COVID ho jayega, let's not do this. The pandemic significantly increased the childbirth induced by stress, leading to premature childbirth in many women. Most hospitals weren't equipped with this. There were a lot of hospitals earlier who were taking care of prenatals and, maternity issues. But now every hospital is a COVID hospital. And they don't have a choice. We have no right to blame. But there is nothing available, unfortunately. We have been overwhelmed. I think it suffices the answer. I can go on talking.
Yes, ma'am. And this is the story of someone who's reached out for help. So there must be more women who have not reached out and who are having more difficulties.
Absolutely. This is only urban side I'm talking about. Rural, you can't even imagine what they're going through.
Yes, ma'am. So, ma'am, domestic violence has been a part of our country's history, I think, and it has been understated the whole while. But what has pandemic done to the domestic violence in our country, ma'am?
See, now with the background that we've just discussed earlier and the death toll rising, and then you hear so many domestic violence cases. Globally, there are about 243, 245 million women who've been abused during this phase between the age group of 15 to 49. But the question comes that what is the difference? It always existed. What has changed today? How is domestic violence any different during the pandemic? The laws are still there that were protecting us. The enforcement agencies are there. The courts are there. Why this special feature on domestic violence during the COVID-19? Now, there are studies that relate, before the Domestic Violence Act came in, there were parliamentary debates, there were studies on it, that what is actually causing it, whether drugs, alcohol, employment status, poverty. There were so many issues that led to Domestic Violence Act finally. And we acknowledge that it's associated with a lot with social environment, space for each other, employment status, alcohol, social dependency. All these factors have gone under dramatic change and increasing frustrations now, coupled with lack of means to survive, family bickering. Now families are living together. The wife is also at home, husband also, in-laws also. So when you stay together in a very less space, and this is a practical problem, you start bickering, you start talking. The husband will get frustrated, the wife will get frustrated, somewhere they'll get into a brawl. And I am not talking about poor people, so as to say. I'm talking about very elite class also. They're also going through equal amount of physical abuse. I do domestic violence cases day in and day out. And it's strange and surprising that even educated class today is going through all this. Despite all the means available to them, they have no shortage of funds, they have no frustration, they are going for holidays where they want to, but still all this exists. Why? To me, I really feel that space and society is very important for us. We are social human beings. We need to talk, we need to discuss. There used to be issues we used to discuss. There used to be a mediator. We used to talk about it. There is nothing existing today. There is nothing. Now let's understand that during the pandemic, also what's changed is when survival becomes the priority. For the world at large, crime relating to women is really nothing that people really bother about. It takes a back seat. It doesn't mean it doesn't exist. The cases are existing. It just goes unnoticed. No one complains about it. No one is attending to it. Our law enforcing agencies like court, police, domestic violence shelter homes, they all stood very strong pre-pandemic. They were like pillar of strength for women. Today, suddenly they've been paralyzed due to lack of staff, fear, social distancing. Courts are 50% strength working. There are only urgent matters being filed. I don't want to blame anyone. It is unprecedented. This time was never thought of by anyone, whether medical practitioners, whether lawyers, whether police, any one of us. Our country used to be very well equipped and exhaustive with laws. And I was really proud. I was doing an international conference on women's rights. And I said, listen, I've seen other countries' law, but I think we are equally well equipped. We have everything. Talk about POSH, talk about Domestic Violence Act, talk about equalities. But suddenly, everything has taken a back seat. There is no one talking. There used to be court interventions. There used to be social campaignings. But second wave has shaken us. It has completely paralyzed us. For my sake, I'm telling you, there are times that I want to meet people. I want to meet my client. I see bruises on Zoom, but I really don't know what to do. There are trial courts which are shut. We go file police with a lot of intervention, immediate steps are taken, but it's not easy. How many times can you do that? How many times do you invoke the jurisdiction during such times? Because filing is also not easy. It has become a problem. But after facing, I think, second wave, and hopefully no third wave comes, we have to understand, we have to upgrade our systems. We have to understand that we do not live in the world that used to be. Everything has changed for us. Our laws are there, but we need to amend them. Our problems are there, but we need to cater to them very differently. We used to cater to them, but now everything is going to be different. How are we going to ensure that? How do we do that? Do we lock an abuser in one room and lock the room? Is it that kind of arrest one is looking at? Not just home arrest, ghar band kar diya and then you leave. That person needs to be punished somehow or the other. How do we do it? How do we show people that law hasn't slept? Law is still there. How do we make it this deterrent law available? It is very much there, and men need to understand. And I'm sure slowly and gradually we are we are waking up to it. Like I am doing seminars regularly. I am posting on various groups regarding new laws, how people are changing, giving WhatsApp number of my juniors. We are doing a lot of legal aid, but I think it's still not enough. Our legal fraternity also has to step up. Everyone is doing their bit, but I think a lot is required. And I think from medical practitioners, we have to learn. We are way behind that way. In fact, during this time, there was a report by National Commission of Women. I must quote here. They reported a significant surge, at least 4 times in reported cases of violence in India. Stress, loss of employment, disruption of social and protective network, and decreased access of services have increased the risk of violence in India. And the health impact that has also happened due to violence is not just superficial about bruises. There are deep-rooted impacts, serious, and which has caused injuries, serious physical, mental, sexual, reproductive health problem, HIVs, sexually transmitted diseases. But there are no hospitals available. We can't go. We are scared. We can't advise, okay, go get your MLC done. Aapko chot lage, aap MLC kara lo so that FIR lodge karaye. How do we get the MLC? It has become a problem in every which way we are looking at it. In fact, I came across a very good app recently called Yopol, which has been used in Italy. This was initiated by the government, where victim has to just click on the phone and the help is available. There are various schemes available by different government, even with our government. There are various means coming, but I think nothing is enough. People are so scared of this. Maybe we have someone coming for surveys regularly from the local police station to find out, or in the pending domestic violence cases, because that are still very prone to domestic violence, because you already have established that he's an abuser. You take regular reports, whether by calling, whether by online calls, so that you regularly update your system. Tomorrow, when courts do open, you have your report ready, and the man who's been abusing is aware that my conduct is not being hidden. It is right there. It's being reported every second. Anything else?
Yes, ma'am. The last question will be like, there are gender inequalities at workplace, ma'am. And now that women are working from home, so they are playing dual role the entire day. So what are the ways to ensure equality at workplace going forward?
Depends on which lens you are looking at this from. There are 2 sides to the coin. How employment new norms have helped some women and how it has been disastrous for some. In urban educated segment, work from home has certainly boosted the gender parity and has emerged as a great equalizer in terms of gender diversity or increase in female representation across key sectors. Flexible working hours has helped us women to manage our children and household chores and take care of elderly in our families. Now, within this also, if you see, there is disparity, there is inequality, and that exists in our society. You can't change it, not overnight. Nothing is going to change that, at least till we have a concrete plan in place. While working women, be it online, is expected to manage household chores due to lack of house help coming or the staff coming, but men, on the other hand, have managed to have a clear-cut focus on office work. Disparity is inherent even here in urban class. I'm not saying every man is like that. Of course, there are a lot of men who've been helping their wives, and thank you for that. I mean, people are changing, they are evolving. I think this pandemic has taught everyone a very rude lesson to upgrade ourselves, to understand how to cater to these problems. The pandemic for sure has disproportionately affected women more in terms of employment. It has increased the unpaid work and put extra burden on all paid jobs, affecting the equality, affecting the quality. I remember a client of mine was trying to retrench women in his office. And I just asked a simple question, why would you do that? He's like, madam, they are not able to work. The quality I'm not happy with the quality. On the other hand, men can deliver better. They have more time. And in my head, and I actually told him, I said, men couldn't have done this without women. If women weren't to take the back seat and take care of the household chores, frankly, it's all thank you to women today that men are delivering properly. We forget that Women are actually pillars of strength for men. And if we do not work together as a team, our nation will suffer. It is not about man, woman today. It is about human being. When the virus is not discriminating, please don't discriminate. We need to understand, we need to change our society, our norms to tell them, let's not discriminate. It has taught us in a very, very big way. In fact, the laws regarding equality, since you asked this question, are already there. Our constitution in itself, there are Article 14, 15, 16, which are clearly providing that there cannot be any discrimination on the basis of equality. There are laws in place like sexual harassment of women at workforce. There are laws of domestic violence. But unfortunately, despite there being so many laws, it's not being enforced because the situation is such. It's no one's fault. I mean, we are trying now. In fact, the High Court is working till 5th of June, which is an extended hour. We are taking care of all such issues. But no matter what we do, we need everyone's help together, not just lawyers, but society at large. It is everyone's job to do it today. Like I say, it is not the doctor's job to cure you. It is also your job how you actually secure other people by staying home, wearing masks. This is not what doctor is going to do. Doctor is going to help you after you are sick. But before that, prevention is better than cure. So please, let's help each other and evolve from this pandemic better. There are schemes like, there were schemes like Beti Bachao, Beti Padhao, other schemes. In fact, in Delhi, I remember in February last year, we saw unemployment rose to about 40% by May 2021. This led to incorporation of a scheme called Saheli Samay Kendra in Delhi, which empower women and uplift them during lockdown and pandemic. Now, such scheme needs to be, promoted by the central government and the state government. There needs to be limited hours for women because now they are taking care of their household chores, they're taking care of their kids. So please limit their hours, give them flexibility. Whatever time they need, they have to do online work. Don't ask them to join office at 10 o'clock online. It doesn't make sense. They're also doing a lot. So please help them some way, because if women fail, this system will fail. It works on all pillars. Only one pillar can't handle it.
Thank you very much, ma'am.
And thank you so much for having me as a speaker. It's been a privilege and a learning experience. And to get a first-hand information from the doctors is priceless today.
Thank you, ma'am. Thank you. We're very happy to hear such a strong
Monica,
voice. You're the voice of all the women.
Yeah,
Yes,
Monica, thank you very much. And you have accepted yesterday only coming to this forum. I know that you can do this job very well. How the people have given the comments. You really inspired us, energized us. Motivated speaker. You are motivating us. So that is what your charm is and your force. And you rightly put the cause of the women and gender is properly understood. I was talking to you yesterday, and I was there in Indore during the lockdown period, and it was the first lockdown, and nothing was moving. No vehicle, no people were there. But our laborer just left to their home, and they were walking for many days together, going home walking. So you can imagine that how much pain a woman has suffered. And we had one girl who has taken the father to the home. It took almost 12 days to go to the home. So you rightly said that women are the most sufferer. But I'll give you one interesting finding that, the deaths among women is less in COVID as compared to men. It's a very interesting one. So that also shows that women are actually very strong being, very strong, genetically. So I don't know. We can say that that is why people are exploiting more. But that's not the cause. That should not be the.
And people forget that.
But now, thank you very much, dear. Thank you.
Thank you so much. Thank you so much.
Ranabir.
Thank you to
Now
all
it's your turn.
doctors. It was a pleasure, Dr. Surabhi and Dr. I think
Soumya.
Dinesh.
Soumya.
Dr. Soumya, of course,
Yeah,
and Dr.
and
Dinesh. Thank
Dinesh.
you so
Dinesh
much.
is also.